Good afternoon. Today we're going to be doing an assessment of the skin, the hair, the nails, the head, the neck, and the lymph nodes of our patient, Christy. Christy, how are you today?
Good, how are you?
Good, good. So Christy, for a couple questions for you as far as your skin. Do you have any drug allergies?
No known allergies.
Okay, and have you had any health problems before?
My only past medical would be some acne and appendicitis. I had my appendix removed.
Okay, and as far as any kind of current skin issues, do you have any current skin issues right now?
I might have some mild acne, but that's pretty much it.
Okay. So as we look at Christy's skin, what we first observe is that her tone is pink throughout. We also look at the texture of her skin, and her skin is smooth. There is no rough bumps noted. As we check, we also will check her skin turgor, and she has a media elasticity noted. As we're looking through her facial features, we can notice that the skin tone is even. There is a slight rosacea on the cheeks. And Christy, if you don't mind turning your head to the left here, we see that there's a small cafe au lait spot. When we do assessments of any kind of moles, what we're going to look for is it asymmetrical? And in this case, it's not asymmetrical. There's a slight variation. We're also going to look at the borders of it, and the borders are within control. We're going to look at the color of it, and it's a very light brown. We also, as we're assessing this, we're going to look at the diameter. And in this case, the diameter is roughly about 5 millimeters. As we continue to assess the mole, we're going to look at is there any elevation, and there's no elevation. And we'll also look for any kind of evolution. And from my understanding, you've had that since you were a child?
Mm-hmm.
Excellent. Yeah. We'll also look at if it's firm, and there's no firmness. And then as we talked about with growth, there's no abnormal growth. Also, as we look through her skin, we notice that it's uniform. There's no diaphoresis or moisture. And so at this point, our skin is well intact with normal color. The next part is we will go to the assessment of the nails. And as we assess Christy's nails, what we can see is that it's pink in tone. We will check for cap refill. And the capillary refill comes briskly back in 1 to 2 seconds. Her nails are well groomed, as we noted throughout. The luna is white. The linear folds are about 1/60 or normal. And what we can do is we can check for clubbing. And in order to check for clubbing, what we're going to check for is a Schirmroth sign. So as Christy, if you can put your nails together like this, we can see that Christy has a diamond shape, which would indicate if there was any kind of clubbing. And if there was any kind of clubbing, then that might note an oxygen deficiency or some sort of vascular deficiency. But in this case, there's a good diamond, as you can see. Now, as we do look at Christy's nails, Christy does admit to biting a little bit on the inner part of the nail itself. And on a couple nails, we notice a slight yellow discoloration, which is parenchyma. And in her case, there's not a very marked, just a couple small areas. As we assess her nails, there's no Bowes lines or Mies lines. And again, overall, the color of the luna is white, and so the nail assessment for her would be normal. The next part we're going to move to is we're going to move to her hair. And as we assess her hair, the very first thing is, Christy, do you have any history of alopecia or bald spots at all?
No.
No. And as we can look at Christy's hair, we can notice that there's a full texture. The hair itself is very smooth and shiny. It's well approximated throughout all the edges. And also, if we look towards the back of Christy's head, we can notice what we'll look for is any kind of spots. You can see that the texture of the hair is full. The edges of the hair themselves are approximate, so there's no drying or cracking of the hair. And then at the end, there's no split ends. So nutritionally, this would be very good. Now, another part of what we would like to assess is her scalp. Christy, do you have any issues with either ringworms or any kind of lice before in your life?
Never.
Never. And so as we look throughout Christy's head, we can notice that the scalp itself is nice and white. There's no flaking tissue There's no obvious lesions noted. And so you want to make sure when you're assessing the hair that you really kind of get down in those lower folds to make sure that it's uniform throughout. And as we assess Christy's hair, we can see that it's well maintained. Go ahead and sit forward for me again. Thank you. And so as far as her texture and hair, relatively, this would be what is considered healthy. The next part we are going to look at is we're going to look at Christy's head. And so by looking at Christy's head, we want to look at different parts of her head, and we're going to look first at the face, and we're going to look for symmetrical. We'll have Christy smile for me, Christy, and we can see the facial labial curvature is appropriate and well approximated. We're going to look at the frontal lobe of the head itself, and there's no defects at all. We're going to look at our temporal lobes, and we can see that they're uniform bilaterally. We'll also look at the parietal lobe, and that's also uniform. If we have Christy turn to the side, we can see that the occipital lobe of the head is also normal. Now, before we would consider her head normiocephic, what we want to do is make sure that there's also no lesions noted, contusions, or bumps. And so the way to do that is what we'll do is we'll just palpate just gently into her hair, and there's no obvious defects noted. I will assess the back individually and make sure that I go within different sections of the head. And again, there's no depressions, fractures, or any kind of linear changes. The next part of what I would like to do in the assessment of the head itself is I'm going to also assess her for her temporal artery. And so in order to do the temporal artery, what you'll do is you're going to feel over the temporal lobe itself, and what you'll do, use the pads of your fingers, and you'll feel for pulse. And in case there's a pulse, and there's +2 sensory on both sides. Okay. And what you're going to want to do is you're also going to want to auscultate using your stethoscope. And as you auscultate, what we ask you to do is the very dull sounds is to use the bell of the stethoscope. What I'll do is I'll place it right over the temporal lobe. And again, there's a negative bruit felt, and the pulses themselves are well approximated. And you also want to check that to her central pulse. Good. So in this case, on our assessment of Christy, we're going to notice that she's normal salic, that the head itself is well approximated, that there's no linear fractions, depressions, or any kind of abnormalities noted. With that being said, what we'll next move on to is the assessment of her neck. And as we look at her neck, what we can first notice is that she can hold her head up in normal position without any kind of tremors or any kind of weakness. We can look at the neck, and Christy, if you can turn to the center for me, please. What I first am going to look at is the muscle structure of the neck itself. And the muscle structure of the neck is well approximated. I will go ahead and look right at the midline, and the midline itself is also approximated. I will check for both cricoid with a slight palpation, and then also for the thyroid. And what we'll do is, Christy, if you can swallow for me, we can see again that the trachea is midline, that she's able to swallow without any issues. We check the jugular neck part of the neck, and there's no distension noted. And again, with your stethoscope, you're going to want to check for a carotid pulse, both palpation and then auscultation. Christy, if you can hold your breath while I do this, please. It's important to have them hold their breath so that you're not getting their breath sounds. And in this case, there is negative for any kind of bruit, and there's a good pulse with that. And then when you assess the neck itself, it's very important that you don't cross over the neck, that you use the pad of your fingers on the same side of the neck that you're working. So what I'll do is I'm going to go ahead and move around to the right side of Christy's neck. And again, I will palpate for the carotid pulse and I'll also auscultate. And again, there's negative bruise and there's a good pulse noted. I'll also check her for her thyroid at this time. And by checking for her thyroid, Christy, if you can turn your head to the left for me, what I'm going to go ahead and do is I'm going to go ahead and slightly palpate to the right for the thyroid. And again, you should be able to feel the thyroid to the right itself. You shouldn't feel any kind of swelling or any kind of abnormalities when she swallows. And Christy, can you turn your head to the left for me? Excellent. And as we assess the left side of the neck, again, we're going to go ahead and feel for the thyroid itself. And we're going to have her swallow again. And again, there's no abnormalities with swallowing. So that is her neck itself. The last part of it for the neck assessment, as we already talked about, was we'll look at the muscle structure. So if Christy can turn her head to the right for me. Okay, all right, in this case we'll go to the left. And I can see the trapeze are intact, and then also your mastoid muscles are also intact. The last part is the lymph nodes, and as we assess the lymph nodes, what we're looking for the lymph nodes themselves, are they swollen, are they warm, or are there any kind of irregularities? The first part of the lymph nodes we're going to feel for, we're going to feel for the periauricle, and that's just in front of the tragus of the ear. And there's no obvious step off with this or any kind of abnormality. Now, for time's sake, what I often do is at the same time that I assess for these lymph nodes, I'm also going to assess the patient for any kind of TMJ or any kind of abnormalities with the mandible. So in this case, what I'm going to do is I'm going to have Christy go ahead and click and move her jaw to both up and down. And it's normal. And Christy, are you having any pain with that?
No.
Okay. And can you go ahead and move your jaw to the left and to the right for me? And again, as she moves the jaw to the left and the right, there's no clicking or any kind of popping feeling that would indicate either TMJ or some sort of abnormality with the jaw. Coming back to our lymph nodes, again, I'm going to check what's called the postauricle, which is directly behind the ears. And so what I'll want to do is I'm going to actually go right behind the earlobes themselves, and I'll palpate. Again, it's very important as you palpate to use the pads of your fingers. Next, what I'll check for is the occipital lobe. And again, we talked about the occipital part of the head. And in this case, we're going to look for that occipital lobe. And there's no occipital step off or swollen lymph nodes that we can feel. We're also going to check the tonsillar, and the tonsillar themselves will be right at the mandible angle of the jaw. And so again, we're not feeling any kind of step off there. Next, we'll check the submandibular. And with that submandibular, you're checking right at the angle of the jaw, halfway between the jaw and the angle and the edge of the mandible. And you'll feel up and just slightly in, and again, there's no obvious swelling noted. We'll also check the submental, and the submental is right at the edge of the jaw. And again, I'm not feeling any kind of lymph nodes. And the submental would take care of any lymph nodes of the tongue or the jaw or the mandible. Next, we're going to check the subclavicular, the super cervical. And as we go down the cervical, what I'm going to do is I'm going to have Christy turn her head to the left. And what I want to do is I want to palpate down the muscle of the neck itself. And as I palpate down, I'm also looking at the deep cervical. And then right as we turn our head to the right, we're also going to check for the deep